Good day, I'm Jackie Judd. It's that time of year, open enrollment season, when workers who get insurance coverage through their employers must select a policy for 2012. It can be a time of high anxiety for some. Michelle Andrews, who writes Insuring Your Health, is here to provide some guidance. Welcome, Michelle.
Hello.
What are some of the most important aspects of health insurance coverage for someone to consider when it's time to change or re-up what they already have?
Well, people shouldn't assume that their plan will be the same. I think that that's everyone hopes that they don't have to go through the process of thinking about it, but their plan may change. And if they're at a company that offers another plan, then they need to think about that. Or if they have a spouse who has coverage, they might want to switch. In terms of specifics, you really need to look at premiums because those are going up significantly in some cases. And you also may find that you're going to have a much higher deductible. The proportion of plans, companies that are offering plans that have deductibles of at least $1,000 is really on the rise.
But what should consumers think about in terms of their own lives? Has their health status, for example, changed from the previous year? Has one of their children maybe aged out of being able to be on the policy? Those kinds of things.
Yes, it's always important to look at your past experience with healthcare because that will help you make some decisions about what kind of coverage you need next year, whether you have chronic conditions and have medications that you need, that kind of thing. And insurers are, in fact, and employers are raising what they're charging for dependent coverage. That's a trend that they're seeing more of. So you might want to look and see what that coverage is going to cost. And again, if you have a spouse, then maybe consider moving the spouse, your child onto the spouse's policy, that kind of thing. Some companies are adding spousal surcharges. So if your spouse has coverage, they may in fact say, well, if you want to stay on this policy, it's going to cost you extra. Those are all changes that you want to take a look at.
Another trend seems to be in the area of wellness programs. And there may be some financial advantages to taking a look at how those factor into an insurance policy. Tell us about that.
Yes, more and more companies are hitching their wagon to wellness plans, policies, and programs. They are hoping that if they help people control and take care of their chronic conditions and stay healthy, that will down the road reduce their own healthcare costs. We don't really know that really will happen, but that is the hope, and it would seem that should happen. So people who participate, whether it's filling out an employee questionnaire about your health, what they call a health risk assessment, or taking part in a stop smoking program, a weight management program, joining a gym. There are all kinds of different things that companies offer. You can sometimes get a break on your premium, or you may get other kinds of financial incentives.
There was a survey taken of workers asking them how they thought they did in selecting a policy coverage. And 3 out of 4 said they felt they had made some mistakes. And a good portion of them felt that those bad mistakes had led to what they would consider extra costs. What kinds of mistakes should people be looking out for to avoid?
Well, I think we've talked about a few of the big ticket items like, deductibles. Don't ignore that because more and more in plans you'll see deductibles within deductibles. If you're someone who has to see a specialist a lot, you may find that there's extra charges for seeing that specialist every time, or if you have to go to urgent care, there's this extra charge there. If you take drugs, there's so much tiering that goes on where if you are taking a brand name drug, it costs you one thing, and if you're taking another drug that isn't a brand name but it's in a specialty tier, it's going to cost you money. You need to look at all of those things, and I think that's where people think that they make mistakes, is that they don't spend the time really going through what they actually need every year and calculating what it's going to cost. And companies sometimes on their websites actually have calculators, so you should check with your company to see if that's there.
How much time should people give themselves to consider this pretty significant decision, given how expensive it is to get health care sometimes?
Well, we were talking about a survey that said that employees needed about 3 weeks to make that decision. Now, I don't know that they need to spend 3 weeks going over everything, but don't sit down on Friday night or Thursday night and expect to sign up on Friday morning. That might not be enough time.
And the best place for it to get some advice?
Well, start with your human resources department. They're the people who are there to help you, and they provide the coverage, so they should know the answers.
Okay. Thank you very much. Michelle Andrews of Ensuring Your Health.
Thanks.